So March is Colorectal Cancer Awareness Month. So what better time to talk about prevention? Dr. Patrick Szeto, a colorectal surgeon at CHI St. Vincent, joins us now to talk really some important advice. Doctor, thanks for coming in and doing this.
Thanks for having me.
We appreciate it. For folks who aren't really sure exactly what we're talking about when we talk about colorectal cancer, tell us what we mean.
Yeah, it's definitely an unfortunate problem, but basically it's just a abnormal growth of cells that's in your GI tract, in your colon and your rectum.
Right. So you diagnose this generally through a colonoscopy? Generally?
Yeah, generally, it could be picked up on a CT scan or some kind of imaging, but ultimately you have to do a colonoscopy where you actually get an eyes view on it, and you get a biopsy to prove that it is colon cancer.
The rates of survival are improving all the time, but this is a largely preventable cancer. Am I right about that?
You're correct. Yeah, definitely catching the cancer or even removing a polyp at the early stages will increase survival.
Well, let's talk about who needs to get screened for this, because I'll tell you right now, I'll share this story real quickly. I waited way too long. You said about 50 is generally when you should be screened?
Yeah, back in numerous years back, 50 was the age. Now is down to 45.
45, and especially if you got a family history. All right, so I was going to say I waited till I was almost in my late 50s. I'm in my late 50s now, but this last year, I went in there, and the doctor, when the procedure was over, he said, "You came just in the nick of time."
Yeah.
I had all kinds of polyps that they fixed, but I put the procedure off because I'm stupid and I'm stubborn, and I suspect you hear that all the time, don't you?
Yeah.
The people don't come in, they put it off because they think it's going to be difficult or something, and it was simple.
Yeah, that's why we stress the importance where we try to push our patients to get their colonoscopy, to get educated, when to get it, and that helps.
And the way you're treating colorectal cancer has changed too. You use robots, right, in the surgeries?
Correct.
When you actually get to the cancer treatment itself, right?
Yeah. There's numerous treatments for colon cancers. It could be a local resection. It could be a colon resection using minimum invasive, either laparoscopically or robotically. And then some patients, if it's a further stage, they may need chemotherapy and radiation up front.
But still, again, you got to get out in front of it. And again, so some of the risk factors are what? Obviously, I mentioned family history. What else are some of the risk factors?
Yeah, it's basically sedentary lifestyle, inactivity, obesity, consumptions of processed meats, smoking, large consumption of alcohol. Those are all some of the risk factors.
Recommend some dietary stuff for us if we wanted to change our diet.
Definitely a high fiber diet helps. Okay, and then avoiding a lot of processed meats that will help as well.
So in order to get a screening, obviously St. Vincent is tremendous at this. What do the folks need to do to contact you all to set up a screening? Do you get a referral from your primary physician, or how does that work? Yeah,
usually the gatekeepers, your family care doctor, and they'll usually does the screening and then tells you you need to go to a gastroenterologist or a colorectal surgeon to get their colonoscopy.
And I suspect you need to get proactive about this, right? If they're not bringing this up to you, you need to bring it up to them, right? Say, I need to do this. I need to have the screen.
Yeah, all the patients that we see, even when they come see me, we educate the patient. We also educate them to tell their families to make sure that they get their colon cancer screening at 45 or even earlier, depending on their history.
Yeah, and talk about that history. Is that the biggest factor, or just one of the big factors in whether you're going to be more susceptible to this?
It's actually just one of the big factors.
Okay. Well, I thank you for being here and sharing this information, because it is important. And believe me, I was scared straight.
Yeah.
By going to that colonoscopy. I'm going back every year until they tell me to go away.
Yeah. Well, thank you for having me.
No, you're welcome. Again, the information CHI St. Vincent will answer any questions you got and set you up if you need more help. Back after this break, one more weather to go.